you talked about being siloed off in these different sections of life, but it's really not even just that person's life. Women have such a huge impact on their families, on society, and they're not just giving birth to other women, they're giving birth to men and women. So that has a huge impact on the next generation, as you said. From your extensive research and from your experience, what kind of societal benefit is there to having some kind of standards or a general minimum level for what we should help women to achieve from from the beginning, really?
Sure. Well, standards are the best available benchmarks that we may have when we try to assess a particular situation. Those benchmarks are usually established by doing rigorous research on a particular topic under the most ideal circumstances possible. So let me give you one example that comes from a project that led by a consortium we are members of. It's called the Intergrowth 21st Consortium. They looked at more than 60,000 pregnant women, normal pregnant women, across the 5 continents, and measured very carefully using standard protocols and very rigorous protocols. They measured how their pregnancies were progressing. They measured the birth weight of the babies. They measured how the babies grew over the first 6 months of life, and they measured the neurodevelopment of the child over its first 2 years of life. And with that data, very robust data, they built graphs that allow clinicians and public health professionals to look at the growth and development of babies everywhere around the world and compare them with these standards that very accurately reflect what's the ideal growth and development. So the standards represent the ideal situation in whatever dimension of maternal and newborn health or any other type of health domain. So with these new standards, we are now able, in the United States or someone in India, will be able to see if a child is growing as he or she should, or if there is a delay in his or her growth that would require some kind of special attention, or that clinician will be able to reassure the mother that everything is going well as well. So those standards are very, very critical in terms of healthcare and also for public health purposes, because we will be able to compare in this case, the growth and development of children in different communities, in different social groups, at different points in time, and reach conclusions about whether things are going well or not going so well, and what needs to be changed. And by the way, sorry, one quick point, because related to a question you asked before that I didn't answer. You asked me about the impact of race and ethnicity, and let me connect it with the standards I was referring to. An interesting finding of this study, the Intergrowth study, was that race doesn't have any effect on size at birth and development. I mean, children of any race develop the same and grow, and when they are born, look the same everywhere. So whatever effect some people think race could have on those aspects of life, so important at the beginning of life, well, that's not true. That was completely dispelled by this study. But race has a big impact on maternal health outcomes. But that's not because of biological factors, that's because of social factors. And the US is a sad and unfortunate example of that. United States has the highest maternal mortality among industrialized countries. And not only that, within the country, there are huge discrepancies in terms of maternal health outcomes between women of different races, with Black women having 3.5 to 4 times a higher maternal mortality than women of other races. And in some cities, the difference is still bigger. In Chicago, for instance, the difference is 5 times, and in New York, it's 12 times. But that's not because Black women have anything special, biologically speaking. It's just because they have a lower socioeconomic status, they have less access to good education and information, they are subjected to discrimination, implicit or explicit biases, they don't have equal access to the healthcare system. So all those factors are the ones that explain the differences by race and socioeconomic status, nothing biological.